one arm of the healthcare reform mandate is creating risk and exposure for organizations on the other end. So the enforcement arm of the government versus the legislative arm that creates the laws aren't really in sync in terms of what they want the healthcare industry to be focused on. So that creates a conundrum which creates greater risk and exposure for the healthcare industry right now. Most chief financial officers, many of whom spoke at the annual American Hospital Association meeting in San Diego this past July, many large system CFOs that speak to the industry generally. So they're most concerned about IT costs and implementation. They're significant. They're not easy necessarily to do, and the missteps of implementing IT protocols in order to affect electronic health records, et cetera, can be very costly in terms of unintended data breaches and various sorts of missteps that can result in exposure for the organization. Government enforcement activities, we'll talk in a little while about the Health and Human Services and the Office of Civil Rights, prosecution of fines and penalties against organizations who violate the HITECH Act, which is now an extended amendment to the HIPAA law that now requires every data breach to be notified to affected individuals. This wasn't the case historically. We'll go about this in more detail in the presentation a little bit later, but the government enforcement activities are so robust. They're only going to continue to increase through 2014, 15, and 16, and obviously can present a crippling blow to an organization financially to have a government assessed fine or penalty for a data breach when all they're trying to do, the organization, is adopt the protocols they're being told to do. And physician alignment challenges, it's difficult, many organizations are finding, to bring on new people into practices that may have not worked in a hospital system or so forth before. So getting that dynamic to be fluid and all under one protocol smoothly is creating challenges internally for many organizations. In terms of what management liability exposures are increasing, we really are seeing mostly the D&O, directors and officers, which really is the organization governance, employment practices liability, and then cyber first party, which is your data breaches. These are the exposures that are most significant in terms of frequency increasing. And this in large part is due to, as we talked about, the economic pressures as a result of health reform. The economy still has a high unemployment rate. The IT advances that are mandated to adopt electronic health records in the healthcare industry is creating